Thank you for joining us today. As you may already know, especially if you've joined us for one of the previous webinars in this series, a foundational concept of humaculture philosophy is feed the soil, not the plant. The most successfully sustained organizations are those focused, whether intentionally or not, on cultivating an enriching workplace where people thrive. Those focused on people, paying the highest wages or attempting to compete by having the richest or latest fad benefits, often encounter extremely difficult stretches when they suddenly realize they must refocus their attention on the bottom line. In fact, it is easy for an organization to be reactive and become distracted by all sorts of things that seem to be the most important at any given time. As in the prior webinars in this series, today's presentation helps organizations identify ways to stay focused in spite of, or perhaps because of, things that might otherwise be distractions or impediments on the path to success. We believe the best response to the Consolidated Appropriations Act and the No Surprises Act is through an approach that combines strategy and compliance. This approach will also help improve the perceived and actual employee value proposition of your organization, contributing to the fertile soil you seek to cultivate. Let me introduce our speakers for today. I'm Steve Cyboran. I'm an actuary and have over 3 decades of experience in people support, traditionally HR, benefits, and total rewards. I've conducted research and take a behavioral approach to all reward programs. Wes Rogers is our Humaculturist. He combines his more than 35 years of business and leadership experiences, as well as the research and case studies from my past, to conceptualize the organization through the horticulture metaphor and apply its principles through the 7 dimensions of humaculture. Jack is our strategy and compliance consultant. He's a lawyer with decades of experience. He is a pioneer of several benefit innovations and has frequently testified at the Department of Labor on various HR and benefit issues. Let me introduce our first poll. Please let me know if you've conducted a mental health parity comparative analysis for all of your plans. Remember to submit your response once you've completed it. All right, I'm going to close the poll and share the results. All right, well, it looks like 90% of you said that you have not conducted the mental health parity comparative analysis, which it was probably what we were suspecting, given they are putting out more guidance after all the years that mental health parity has been in place, that they suspected that people might not be complying the way they should. Let me introduce our second poll. To what extent does the workplace impact employee mental health? Please remember to click submit when you've finished. I'll close that poll and share the results. All right, it's like most people felt like it impacted it to a very great extent or a great extent, with only a small percentage of you thinking a small percent. And we'll cover this more and perhaps see how your opinions change over the course of this discussion. Wes, can you tell us a little more about humaculture and how it's important in today's topic?
Sure, thank you, Steve. Well, in each of our webinars, we emphasize a different aspect of the humaculture philosophy and approach. Humaculture is a dynamic paradigm through which to understand, form, and optimize organizations, providing a holistic framework in which to make all decisions. Humaculture borrows many of its insights from the field of horticulture. Horticulture provides a very keen metaphor to understand the organization and its purpose to attract, engage, grow, retain, sustain, and transition the people who interact with it. A good horticulturist understands that the success and sustainability of a garden or landscape depends on recognizing and balancing the climate or terrain, the soil structure itself, the available space and fertility of the soil or growing medium, the arrangement and diversity of the plantings, the specific plants chosen, their characteristics, the conditions that will optimize the availability and absorption of nutrients, and finally, the desired harvest or value to be derived from the garden or landscape. Each of these 7 dimensions dynamically influences all the others. When considered and understood together, they guide the horticulturist's decisions in any aspect of garden creation, maintenance, or design or change. Similarly, humaculture is the art and philosophy of creating profitable, healthy organizations conceptualized as soil in which people thrive. Humaculture forms the basis then for a systematic approach to making all decisions of a business or organization in the context of the 7 dimensions of humaculture. A successful and sustained humaculture is created and maintained by continually evaluating goals and decisions through the lens of the 7 dimensions. Our webinar today is focused on strategic responses to the mental health parity rules that reflect several of the 7 dimensions. The humaculture philosophy guides all of our work, though, even when we're engaged selectively on more narrowly focused aspects of organizations, such as today, mental health. We will always strive to help organizations understand how any aspect of our work can be understood in the broader context of the 7 dimensions of humaculture, and how even limited applications of the humaculture approach can contribute to a successful humaculture. Steve, next slide, please. There you go. So merely complying with the CAA, the No Surprises Act, and the transparency rules is expected to only increase costs for both employer and employee. In the previous webinars in this series, we discussed how a strategic response to the various compliance requirements can create a competitive advantage, result in savings for employees and employer, potentially increase consumerism among the employee population, and more importantly, improve employee health and well-being. Today, we're focused on a lucid approach to the CAA reporting and comparative analysis requirement, which was included in the CAA to support enforcement of the mental health parity rules. Mental health parity requirements are not new. They date back to the Mental Health Parity Act of 1996. The CAA reporting and comparative analysis requirements seem then to reflect a concern by Congress or someone that group health plans have yet to achieve parity between medical and surgical benefits and mental health benefits, despite this requirement existing for more than 25 years. It also seems clear that the reporting and comparative analysis requirements are primarily designed to support enforcement efforts. So employers face a conundrum. They must comply, but mere compliance will likely only increase costs, administration, and litigation risk. So our goal today is to share some ways employers can proactively create a strategic response to address and support the mental health of their employees. The goal is to ensure the organization supports employee mental health and resiliency and is not merely treatment focused through achieving parity between mental health and medical and surgical benefits. So Steve, can you tell us a little more about the history of the mental health parity requirements and their impact to give us a bit more context for our topic today?
Sure, thanks, Wes. Requirements for mental health parity and group health benefit plans is not new. The Mental Health Parity Act was, as Wes mentioned, passed in 1996, more than 25 years ago. However, despite the parity requirements, the annual rates of depression, suicides, opioid deaths, and substance abuse have only increased since 1981. In fact, since mental health parity rules became effective, suicide rates have skyrocketed. Most recently, mental health and substance abuse disorders are a big issue as a result of the draconian and indiscriminate COVID-19 response, including widespread economic shutdowns and the social isolation that came with the forced transition to virtual work and education. As a result, we have seen significant increases in depression, where rates of depression tripled, substance abuse and opioid use, where opioid-related deaths were up 80% in 2020 to 90,000, accelerating over 40 years of exponential increases in mortality. Clearly, any progress toward parity between medical, surgical, and mental health benefits seems to have had little impact on slowing mental health issues. Now, with the passage of the CAA, the focus on benefit parity is intensified, and health plans are immediately required to conduct and document a detailed comparative analysis of both financial and non-financial treatment limitations. The report of the comparative analysis must be provided to an agency upon request. The agencies are ramping up staff to focus on enforcement. Jack?
Sure. So as part of the environment, the newest mental health parity requirements dig very deep into your benefits design, specifically with regard to non-quantitative treatment limitations, or NQTLs. Those are processes, strategies, evidentiary standards, or other criteria that limit the scope or duration of services. So what are we talking about? Think utilization reviews, prior auth, medical necessity, medical appropriateness, something that's experimental, investigational, your formulary design, network tier design, any fail first policies or step therapy protocols, any exclusions due to a failure to complete a course of treatment. Also would include geographic or facility or provider or specialty or other criteria that limit the scope or duration of benefits for services provided. Importantly, it's not only the presence of such restrictions with respect to mental health, substance abuse disorder treatments, whether comparable or not comparable to the medical surgical limits, but also how they're applied. NQTLs that are comparable are nonetheless prohibited if they're applied more stringently to mental health substance abuse disorder benefits than to medical and surgical benefits. You can see the requirements for required disclosures and analysis here on the slide. Must be made available upon request, could be an employee, could be an agency. They must reflect the DOL's self-compliance tool. General statements that you're in compliance won't be sufficient. The analysis itself must have 4 steps. Step 1, a detailed written explanation of plan terms and practices. Next, confirmation why each NQTL is compliant. Next slide. Third, a robust discussion of specific topics. And fourth, where expert information was relied upon in determining compliance, you got to have a written assessment of the expert's qualifications. To introduce these new requirements at this time kind of confirms that the agencies, Congress, somebody thinks that there are widespread abuses. So you should expect more sub-regulatory and regulatory guidance and likely litigation as well. This is all just getting started. Compliance with these new requirements was necessary over a year ago. And again, so if the agencies show up at your work site to audit compliance for a law in effect for the last 25 years, don't expect them to help you with compliance. They'll likely be focused on enforcement. And of course, none of this will support your workplace culture. Next slide. All right, so again, compliance, not optional. If you haven't done the analysis, reduced it to writing, reviewed with experts and counsel, you're a year behind. After 25 years, it's probably time for a strategic response to avoid continuation of the status quo and its trends. We agree with Hall of Fame baseball player, manager, and coach Yogi Berra. When you come to a fork in the road, take it. The new compliance requirements will only add to your cost, and there's a whole nother world out there. As Steve mentioned earlier, a more lucid response reflecting the dynamic interaction of the 7 dimensions can reduce the benefits expenses of your plan, but more importantly, improve your organization's productivity and engagement. Steve, tell us how we can take a more strategic approach.
Thanks, Jack. So what does a lucid strategic approach look like? Certainly, following basic design principles to mental health will help, but will get only limited results. We previously saw that mental health issues have only increased since the passage of benefits parity rules. There is also a risk in focusing too much on the design of benefits. This problem treatment oriented approach can actually prompt behaviors leading to the very risks one would like to avoid. For example, avoid screening tools that are primarily problem focused. For example, Pfizer's industry standard for depression screening tool. I know it makes me depressed when I walk through it. Could it be that they framed the questions intentionally to help sell their antidepressant drugs? But is there a better approach? We believe a holistic approach will be much better. Artificial fertilizer causes growth, but building the right high quality soil achieves lasting, sustainable results. Remember the slide Wes introduced earlier? It outlines the 7 dimensions of humaculture. What happens when a tropical plant is planted in, say, North Dakota? It might make it through the summer, but without an artificial environment, it is doomed in winter. What might happen when a very introverted person is hired to fill, say, a sales role? At the very least, it is likely this person will feel a great deal of stress from the job. As mentioned, for health plans offering both medical, surgical, and mental health benefits, compliance with mental health parity is not optional. However, beyond merely complying with mental health parity, we recommend developing a plan to mitigate or avoid behavioral health issues in your organization. Compliance alone will not likely improve the mental health of your employees. An effective approach will require something more comprehensive. Within the framework of the 7 dimensions of humaculture, employers should consider the requirements of the law and regulation, that's part of the environment, the organizational structure and design, that's the organization, whether employees have the tools and resources, those are real assets, to do their work effectively, whether the culture is healthy and aligned with the business vision and strategy. These would be examples of the intangible assets. Whether the right employees are in the right jobs, this is the people, and whether pay and benefits, rewards, are aligned to support the organizational goals. A holistic approach, appropriately considering and applying the 7 dimensions, will create a more successful and sustainable humaculture. Let's explore some of the ways to do this. In a study conducted by the Families and Work Institute, they defined an effective workplace and evaluated the impact of an effective workplace on various health markers. As you can see, there's a high correlation between an effective workplace and various health outcomes, particularly the incidence of mental health markers like depression, stress, and sleep. In fact, each health marker is about twice as good for people working in highly effective workplaces compared to those working in workplaces with low overall effectiveness. So focusing on problems usually does little to eliminate the problems. Consider our earlier slide that shows how mental health issues continue to increase despite, or perhaps because of, the focus on parity in the mental health treatment. The Humaculture approach is to employ a vision-driven approach. We use the principles of appreciative inquiry to identify the desired state. Then we can analyze the shortfalls or gaps between the current state and the desired state. The same Humaculture approach is used at any level of engagement, whether it is focused on a specific issue or benefit, the broader workplace culture and strategy, or at the highest levels of the organization or business. It is this distinctive approach that differentiates Humaculture, creating fundamental systemic changes within an organization, not merely seeking and implementing solutions to address problems and symptoms. Even apparently well-designed initiatives often have little or no lasting results because they are not rooted in a clear understanding of the organizational vision, purpose, and mission. For example, one characteristic of an effective humaculture, which will create an effective workplace, is an aligned culture, an example of an intangible asset. Once everyone knows the vision for the organization, the humaculturist seeks to assure the organization's culture is aligned to achieve the strategic goals. Cultural alignment differs from cultural health. Cultural health is focused on relationships and working together. It is measured on a scale of bad to good. Nobody thinks low levels of trust is a good thing or poor leadership is a good thing. Cultural alignment, on the other hand, is not good or bad, but rather it's measured relative to how an organization will achieve the strategic goals. For example, customer orientation can be measured on a continuum with intimate and transactional at the various endpoints. An organization like McDonald's will be much more transactional than, for example, a law firm. Understanding this is important to ensure jobs are designed appropriately and the right people are hired for those positions. For example, if McDonald's hires someone that is oriented to be customer intimate to work at the cash register and strikes up a long conversation with each customer that comes in during the busy lunch hour, this employee will not perform well, which will lead to disappointment, stress, and perhaps anxiety. An organization that understands and operates with an aligned culture will be much more effective and create less employee stress than an organization that does not consider cultural alignment. But this is just one example of how the 7 dimensions are used to create an optimized humaculture. The humaculture approach is a shift in thinking in every aspect of the organization or business. Successful, effective organizations, those with thriving employees and lower rates of mental health issues and markers, are those who view their organization and the world a bit differently. Most gardeners, landscapers, and horticulturists are keenly aware that it is impossible to force a plant to grow and perform. Gardening and horticultural texts are replete with examples of the individuals working months or years to get a certain result, fruit or blossom. It is this fact that makes gardening and horticulture so very rewarding for so many. Similarly, the horticulturist is also keenly aware that people and organizations, employees, students, stakeholders of any kind, cannot really be forced to any real level of performance or outcome. Often the focus on problem solving perpetually keeps an organization anchored in problems, which then shapes the culture. Further, many organizations make decisions such as the type and level of employee benefits based on a problem-solving mentality. There should be a shift in thinking from reactive to proactive, from a perspective of management to one of leadership, from a mindset of solving problems to one of creating an organization that produces desired outcomes and reduces errors and defects in the first place. Even in limited applications, we have seen the positive outcomes of the humaculture approach. Based on a study I conducted and published in 2012 that addressed a select number of items included in the 7 dimensions of humaculture, the top quartile on the index we created in that study had healthier employees, they had less employee withdrawal behaviors, and a safer workplace. And these are significantly improved outcomes. In each of our webinars in this series, we share some insights into how to use behaviorally designed rewards and communications to help lead employees to better decisions. Effective behaviorally designed reward programs will lead to employees, customers, shareholders, and others to make the best use of the fertile soil of your organization. Let's consider some aspects of effective behaviorally designed rewards and communications in our humaculture example. Here are a few examples of heuristics from our library that can apply to your reward programs. Use the new laws and regulations as an opportunity to engage employees in the process to cultivate a more nurturing workplace so they become owners in shaping it. Leverage a pledge to get employees to commit to support others and their own holistic well-being. Shift the organization from being anchored in problems to focus on the vision for the future with a rallying cry to achieve it, as prescribed by Pat Lencioni in his book, The Advantage: Why Organizational Health Trumps Everything Else in Business. Identify, select, and highlight behaviors of people who are admired to help champion and model effective workplace behavior. It's time to educate, design, prepare, and encourage employees to cultivate a more nurturing and effective workplace so employees don't become mental health patients. Wes? Wes?
Sorry, was muted. Fixed it. Well, we sure hope our presentation today has given you some ideas to do more than mere compliance. Merely complying with the new comparative analysis and reporting rules, again, is only expected to increase costs for both the employer and employee. In our previous webinar series, we discussed how strategic responses to compliance requirements can create a competitive advantage, result in savings, increase consumerism, and certainly increase employee health and well-being. Today, our focus was on a lucid approach to the CAA reporting and comparative analysis requirement, again, which were included in the CAA to support enforcement of mental health parity rules. As we said, mental health parity rules are not new, and they have been around since 1996. So the CAA reporting and comparative analysis requirements seem to reflect a concern by Congress and others that group health plans have yet to achieve the desired parity between medical and surgical benefits and mental health benefits, despite this requirement existing for more than 25 years. So it also seems clear that the reporting and comparative analysis requirements are primarily designed at this point to support enforcement efforts. So employers face a conundrum. They must comply, but mere compliance, again, is only going to likely increase costs, administration, and litigation. So our goal today was to share some examples of ways that employers can think a little differently and be proactive in creating a strategic response to address and support the mental health of their employees. And again, the goal is to assure the organization supports and doesn't detract from the mental health and resiliency of the employees, and that it's not merely treatment focused through achieving parity between mental health and medical and surgical benefits. Steve?
As we have said, the requirements of basic compliance is not the focus of this webinar series, but we have developed some great resources to support your basic compliance needs. Our final session in this series will expand upon our first 4 webinars and will provide another illustrative example of strategies you can employ to leverage the hidden opportunities to be found in the No Surprises Act and transparency and coverage rules. We want to help you better manage your workplace and benefit programs and differentiate your employee value proposition to attract and support the talent that will best advance your company's business objectives. Next month, we explore the implications of the fee disclosure rules, how to minimize plan losses and ensure your advisors are truly working in your best interests. We are also working on shaping our next strategic series, which we anticipate will focus on nurturing employee performance and growth. We hope you and your colleagues will join us for this exciting and innovative series. All right, now we'll take a few questions, and as we said at the beginning, follow up with a written Q&A to be distributed to all participants in today's session. Let me take a look real quickly at the questions that have been submitted. All right, here's one. I was under the impression that this was going to focus on plan design strategies to address mental health. What do you recommend? Well, we provided suggestions on page 7 to help reshape the benefits as more of an employee support resource to help prevent future or exacerbating current mental health issues and to integrate with other resources. Beyond that, you want to attract people because they are the right fit for your organization or because you provide great mental health benefits? Looks like we got time for one more question. How did the Families and Work Institute define and measure an effective workplace? The Families and Work Institute defined an effective workplace as one that provides job challenge and learning, supervisor task support, autonomy, climate of respect and trust, work-life fit, and economic security. They measured an effective workplace through a series of 19 questions as part of a more comprehensive survey of employees across the US using a Likert scale to determine how frequently each of the measures applied. Well, I hope that helps. Thank you for joining us today. We hope you find this helpful. We would love to hear from you, to learn more from you about what your specific challenges or circumstances may be. Please remember to register for our last session in the series, watch for our next series, and complete the survey you will receive following the session. We really value your feedback. Thank you and have a great day.